There are now over 300 active cases of COVID-19 in the Thunder Bay district. Roughly two-thirds of those cases have been identified in the last week. Multiple schools in the city have reported cases, and several have closed to in-person learning only due to the outbreaks. Meanwhile, other outbreaks continue at the district jail, the Chartwell retirement home, and among the homeless and precariously housed population in the city. The surge in cases has many people in Thunder Bay asking what's going on and wondering if we are headed back into a lockdown. Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit, and she's on the line. Dr. DeMille, good morning.
Good morning, Amy.
Thanks for being here with us this morning. So I'll start with that basic question a lot of people are asking, which is what is going on? What is driving the surge in numbers at this point?
Well, that's a complicated question in many ways, but what we're seeing is spread in different areas and in different outbreaks, for example. I think the biggest one, though, is the one that you mentioned, essentially an outbreak in a vulnerable population here in the city of Thunder Bay. This is sort of individuals who are homeless or precariously housed, but we know that they have stayed in households, or they've had gatherings where in other places where it has spread in there, and what we see is that sort of secondary and tertiary, what we call secondary and tertiary transmission. So it's extended now into certain households, and then if there are people in those households that may be going to work or going to school, then we see the spread that further goes into those locations as well.
And are you able to give me a sense at this point of how many of the numbers that we're seeing right now are connected to that outbreak?
I would say that it's up to, it's kind of hard to define that particular outbreak, but I would say it's at least 50%. I would probably put it roughly there. For now, yeah.
Okay. And we've heard from the mayor spoke yesterday and saying that the call for provincial support for extra help has gone largely unanswered at this point. What kind of help do you think we should be getting at this point?
You know what? I think this is a very significant situation, and we're seeing a very rapid rise in our case numbers. I think really support what the mayor has said recently and what the city is doing. The importance of the isolation shelter, the importance of having staffing able to manage that and support those individuals is probably the number one thing that I think we need to have. And we know that that's a very, stressed system right now. There are many partners involved. There's discussions all the time about, the staffing and, how to provide supports in those environments and to really manage what's happening. And it feels like everything is sort of being cobbled together all the time because of the limited resources. So I really do support what Mayor Morrow has said and would, very much encourage the province to pay attention and please provide the assistance that we need.
Having to cobble things together like that, are you able to, what does that look like? Can you give me a better sense of that?
Well, you know what, there's a number of different partners who have been involved right from the beginning of the pandemic who have managed the isolation and supports for those individuals. But their resources are very stretched right now, like very stretched. We're also seeing some of the individuals who are involved are unfortunately getting COVID because of their exposures to individuals with COVID, and that really causes problems as well. And it is the multiple organizations sort of working together. But fundamentally, we were all stretched right from the beginning, and then to mount this huge response like has had to be done over the last month really has stretched the capacity beyond what we're able to do.
Mm-hmm. In question period yesterday, in response to a question about the situation in Thunder Bay, the government House leader said medical officers of health in the province have tools to act even quicker in response to rising case numbers. What kind of tools do you have that it might have been referenced there to act?
So I didn't hear that, but I think I work with the Office of the Chief Medical Officer of Health and the Ministry of Health, and they reach out to me. I've been providing them updates every day and having conversations even over the weekend. So they know exactly what's happening here, and that's how I operate. And, there's a lot of support there. I mean, we've heard about sort of an emergency brake type thing. I think that's a word that's sort of used without really knowing. I don't have details about how to activate an emergency brake other than through the processes that I'm already using.
So are there processes where health units can go, though, above and beyond the measures that the province has put in place for our area?
Yes. I mean, there are certain orders that can be written, in which we've used in the past here and across the province. However, when we're looking for a broader shutdown or lockdown, or it really comes under that Reopening of Ontario Act, and that's the that's the most feasible way of doing it. And there's also the enforcement pieces are also included in there, and it details not only one or two areas, but more broadly, it details the measures that various sectors would have to implement.
Right. So you're suggesting it might not be as easy as people may think for health units to act on their own?
Yeah, it is not as easy as probably people are thinking, and I know people are asking me to do certain things, and I do have sort of some ability to do that, but the best way is actually to work through the provincial level, and then to supplement that with particular measures that I might want to implement here.
If we could turn to schools for a moment. So Lakehead Public Board trustees have asked to see schools close to in-class learning until the situation calms down here. Will you support that request?
Yes, I do understand where they're coming from, and as I watch the rising cases that we're having, and what's happening in schools right now is that spillover into schools. It's also complicated by some of the changes in the guidance for our case and contact management, which has stricter requirements for anybody in any situation, including in schools, that actually puts very significant operational challenges on schools. So it's not only the case numbers, but the operational issues that schools are facing, and the amount of work. It's it takes a lot of work when there is a case identified and doing all of that follow-up. So yes, the closure, the switching to schools in Thunder Bay to virtual options is on the table right now.
We've talked before about the concerns about variants, that variants of concern might arrive in Thunder Bay. At this point, how much concern is there that a variant might be contributing to this spread we're seeing?
So I am very concerned about the variants of concern because what we know is that they're increasing across the province. We don't have any confirmed cases of a VOC in the Thunder Bay District Health Unit. However, we do have, what we found out a couple of days ago was that we were identified as having the screening that is happening, and there was apparently 3 samples that were positive on the screen that were identified in our area, but that's a screening test only. It then has to go to a fancier test called whole genome sequencing. That the results take 2 weeks to come back, which is very problematic. Now, with respect to those 3 that were identified in our area, we actually are following up with the lab because we don't know which 3 those apply to, which is very unfortunate. And when we reviewed all our test reports that we've had during that week, we were unable to find the 3 that screened positive. So there's a bit of an issue that we're currently actively following up on. And one possibility is and we did have a situation where somebody with an address in the Thunder Bay District Health Unit was identified with a variant of concern, but they were not here at all during that period of time. So they were down south, and so that we might be looking at something like that. But Yeah, we are seeing variants of concern increase across the province. More health units are being identified as that screen coming positive for those VOCs. And, of course, that could make our situation even worse than it is.
So just to clarify, with the tests that you have done, will we have more clarity on that at some point? Is there a time when you think we might know for sure?
Well, I'm hoping because of the supposed 3 that were positive in our area, I'm hoping we can get answers today or tomorrow about that, and we would be able to follow up. And then those tests would take 2 weeks, so presumably they're already being processed to confirm whether they are the VOC or not. I would anticipate maybe in the next week or 10 days we would know.
And then if that were confirmed, would anything change? What would happen?
So, what we would really want in general is we want to know right away when a test is showing even screen positive for that variant of concern. There are enhanced guidance that we have in the follow-up of those cases and contacts of those cases that we would do, and it's a much stronger approach of sort of identifying people who they were in contact with and sort of isolating and working with them. There's broader measures, though, that we are putting in place for any case right now because of the concerns of the variants, and we're already starting to do that.
If we could take a minute to talk about the vaccine rollout. So I know it's still a long game, but health units have submitted plans for their vaccine rollouts. Will you be advocating? Is there a possibility we could see a quicker rollout of vaccines for that vulnerable population that is experiencing homelessness in order to address the outbreak? Yeah.
So I've already been advocating for that in my many conversations that I've been having with the ministry, and I think in part of the broader outbreak response, and we are getting more. Like we are getting some Pfizer amounts of Pfizer both last week and this week, and we do expect to sort of continue to have Pfizer, and we're kind of using that and looking how to use that in this particular population. It's a bit challenging with the priorities that the government has set, that in many ways I'd like to go a little bit outside those priorities to really figure out what we could do with respect to this outbreak.
Given the rising case numbers here, how likely do you think it is that we are about to head out of the red category and back into lockdown?
I think people should prepare for the fact that we are likely going to be in lockdown very shortly.
And for those who say, we came out of 4 weeks or so of lockdown, we saw those numbers rising despite that. What would you say to those who are questioning the value of that?
I do understand that, and I do agree that our numbers were rising, and it was just because where the spread was coming from. I think what we would see the more we're open is we would see more spread. So it will prevent some of the spread, and I that we are, and if it's a full lockdown. So I think it would prevent stuff, but it is challenging because our numbers, it's not necessarily going to be able to control our numbers just going into lockdown.
Dr. DeMille, as always, I really appreciate you taking the time to join us. Thank you.
Thank you very much, Amy.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.